What would you tell someone to look for a quality physical therapist?
That's a question that I wrestle with a lot. I get asked myself that a lot, and am working on trying to put together a book on how to find a quality healthcare provider, regardless of the subspecialty. And I think one of the biggest ones is find someone who's passionate about what they do. So during COVID, when I was working fill-in PT, the weeks that I would have 40 or 50 hours in the clinic, and I would be energized. I love what I do. Versus there are people that are burnt out, and maybe healthcare is not right for them. So someone who's passionate about the work they do is one. Another one is someone who is not just meeting the standard for education. So as a physical therapist, I'm required to get like 32 hours of continuing education every 2 years in Washington. I think it's 24 in Oregon. This year I've got over 120. Last year I've got over 120. I'm just constantly trying to become the best healthcare provider that I can be. So passion, continuing to try and learn, and then also someone who will refer out. Someone who will recognize, here's my area of expertise, and I'm going to stick in this area of expertise, and I'm constantly going to be aware of the other healthcare providers in my area who might fill in the gaps in my understanding. That team healthcare approach, I think, is also really important versus I'm a jack of all trades, master of none. In my opinion, less likely to get truly top line when you're possibly not with a person who is a specialist in what you need.